Most people over 65 are told the same thing about falling. Just be careful and hold on to the railing. It sounds sensible. It sounds safe. But here is what nobody tells you. Being careful does not protect your independence, because a fall is almost never the beginning of the problem. It is the ending. The truth is that your balance starts sending warning signals months, sometimes years, before you ever hit the ground. And almost no one is taught to read them. Consider this. Falls are the leading cause of injury for adults over 65, and emergency rooms see this reality every single day. But here is the part that matters. The great majority of those people had clear warning signs beforehand, signs they felt, signs they noticed, signs they dismissed as just getting older. Today I am going to show you 5 of those signs, the ones your body uses to tell you that your balance system is quietly slipping. And the 5th sign, the one we end on, is something almost nobody talks about. Stay with me all the way to the end, because that final sign is the one that can change how you approach the next 10 years of your life. It is the difference between staying in your own home and losing that choice. Now, why does no one tell you this? Why do you leave the appointment with just be careful and nothing more? The answer is simple, and it is not your doctor's fault. The average medical appointment lasts about 12 minutes. In 12 minutes, a doctor can review your medications, check your blood pressure, and maybe listen to your heart. There is no time left to watch you stand up from a chair, no time to watch you turn around, no time to test the small systems that keep you upright. Balance is not something that shows up on a standard blood test, so it gets missed over and over until the day it announces itself with a broken hip. I am not here to sell you a supplement or scare you into a course. This channel exists to give you the science a 12-minute appointment never has time to cover. I have no product at the end of this video and no fear to sell you. I want you to understand your own body well enough to protect it. Because the stakes here are not small. This is about whether you can rise from the toilet without help, whether you can step off a curb without fear, whether you stay the person who takes care of others instead of the one who needs taking care of. That is what balance really protects. Your freedom to live on your own terms. So think about your own age right now and where you live. Whether you are 60 in Florida or 78 in Manchester, drop it in the comments. It helps me understand who is watching. Now let me explain the one mechanism behind everything you are about to learn. Please do not skip this section. It is the key to everything that follows. Your balance is not one thing. It is a team of 3 systems working together. Think of it like a 3-legged stool. The first leg is your inner ear, the tiny motion sensor deep in your head that tells your brain which way is up. The second leg is your vision, your eyes constantly measuring where you are in the room. And the third leg is something called proprioception, the sense of position coming from your feet, your ankles, and your joints. It is your body's own internal map. When all 3 legs are strong, the stool is steady. But as we age, these legs weaken quietly, one at a time. And here's the danger. You can lose one whole leg of that stool and still feel fine, because the other 2 are covering for it, right up until the moment they cannot. That is why the warning signs matter so much. They are the sound of one leg cracking before the whole stool tips over. If this is already making sense to you, tap the like button so more seniors can find it. Let us begin the countdown. Sign number 5 is this. You have started using your hands to stand up from a chair. Watch yourself the next time you rise from a soft sofa or a low seat. Are your hands pushing down on the armrests or pressing on your knees to launch yourself up? Most people do this without ever noticing. They think it is just a habit. It is not a habit. It is a signal. Here is the mechanism. Rising from a chair is one of the purest tests of lower body strength and balance control that exists. It uses the big muscles in the front of your thighs, the ones called the quadriceps, and it demands that your balance system stabilize you the instant you become upright. Picture a drawbridge lifting. If the chains are strong, it rises smoothly in one motion. If the chains are worn, the bridge needs a helping hand to get up. When you reach for your hands to stand, your legs are telling you the chains are wearing thin. The muscle that should be lifting you has quietly faded, and your arms have stepped in to hide it. Research from institutions studying aging has consistently shown that the ability to stand from a seated position without using your hands is one of the strongest predictors of future mobility and independence. It is that important. Doctors even have a simple version of this test they use in clinics. So here is your protocol. Sit in a sturdy dining chair, the kind with a firm seat and no wheels. Fold your arms across your chest so you cannot cheat. Now stand up and sit down, slowly and with control, as many times as you comfortably can in 30 seconds. For a person in their 60s, somewhere around 12 to 14 full stands is a healthy range. In your 70s, around 10 to 12. If you can only manage a handful, or if you cannot do even one without your hands, that is your starting point, and it is trainable. Do this set of stands 3 times a week. Every week, aim to add just one more repetition than the week before. That slow progression is what rebuilds the strength. Now let us make this safe, because safety comes first every time. Place your sturdy chair against a wall so it cannot slide. Have a second chair or a solid counter directly in front of you within arm's reach, so if you feel unsteady, you have something to grab. Never do this on a chair with wheels, and never on a slippery floor. And here is your stop condition. If you feel sharp pain in your knees or hips, stop. Sharp pain means stop, not push through. A little muscle fatigue is fine. Pain is a signal to rest. To get even more from this, pair your chair stands with a small boost of protein. Try to eat 25 to 30 grams of protein earlier in that day, because muscle rebuilds from protein, and the exercise gives it the reason to. The movement is the signal. The protein is the raw material. Together, they work far better than either alone. But strength in your legs is only one leg of that 3-legged stool. You can have strong thighs and still feel the room tilt when you move your head a certain way. And that points to a completely different system, one that has nothing to do with muscle at all. That is what sign number 4 reveals. Sign number 4 is this. You feel a brief spin or a wave of dizziness when you roll over in bed or tip your head back. Maybe you reach up to a high shelf and the room lurches for a second. Maybe you lie down at night and the ceiling seems to swim. Most people brush this off. They blame it on standing up too fast. But a specific kind of dizziness tied to head position is a classic sign that the first leg of your stool, your inner ear, is sending faulty messages. Here is the mechanism, and it is fascinating. Deep inside your inner ear are tiny crystals, real calcium crystals that sit in a bed of jelly and help sense the pull of gravity. Think of them like the sand in an hourglass, designed to shift and tell your brain which way is down. As we age, some of these crystals can come loose and drift into the wrong chamber. When that happens, tilting your head sends a false signal, and your brain briefly thinks you are spinning when you are perfectly still. It is not in your head. It is a mechanical problem with a mechanical cause. Large clinical studies have consistently shown this type of positional dizziness becomes far more common with age, and it is strongly linked to falls, precisely because it strikes during everyday movements like getting out of bed. So here is your protocol, and this one is about awareness and gentleness. For the next week, pay close attention. Notice exactly which movements trigger the sensation. Is it rolling to the left in bed? Is it looking up? Write it down. When the dizziness comes, do not fight it, and do not keep moving. Stop, hold still, and let it pass, which usually takes under a minute. Then move slowly. When you get out of bed, sit on the edge for a slow count of 10 before you stand. When you rise, count to 10 again before you take a step. That pause gives your inner ear time to settle. Now the safety piece, because this sign in particular demands it. If you get dizzy standing up, never walk until it fully passes. Keep one hand on a nightstand or wall every single time you get up in the dark. And here is the important part. This kind of dizziness is very treatable, but it needs the right person. Bring this to your doctor because there are simple, gentle head movement techniques a trained professional can guide you through that often resolve it completely. Do not attempt aggressive head maneuvers you found on your own. Let a professional lead. Pair this awareness with better lighting. Put a motion sensor nightlight in the path between your bed and your bathroom, because most position-related falls happen in the dark, when your eyes cannot help cover for your struggling inner ear. Fix the ear signal and support it with light. 2 legs of the stool working together. But even with strong legs and a settled inner ear, there is a third leg we have not touched. It lives in your feet, and when it fades so silently that most people never feel it going. That is sign number 3. Sign number 3 is this. You cannot feel the floor as clearly as you used to, or your feet feel strangely numb, tingly, or far away. Maybe your slippers feel like they have extra padding that is not there. Maybe you have to look down to be sure where your feet are. This is the quiet fading of that third leg of the stool, your proprioception, the position sense coming up from your feet. Here is the mechanism. The soles of your feet are packed with thousands of tiny nerve sensors, constantly reporting to your brain about the surface beneath you. Are you on carpet or tile? Is the ground sloping? Are you about to step on the edge of a rug? Think of these nerves like the sensors buried in a road that tell a traffic system a car has arrived. When they work, the flow is smooth and automatic. But with age, and especially with conditions like diabetes, these foot sensors can grow dull and slow. The road goes quiet. Your brain stops getting clear reports from the ground, so it is balancing with its eyes closed, guessing where your feet are. Research on aging and nerve health has consistently linked reduced sensation in the feet to a significantly higher risk of falling, because the brain is reacting late to every shift in the ground. So here's your protocol to wake those sensors back up. It is called barefoot texture training, and it is beautifully simple. Once a day, stand barefoot for 2 to 3 minutes on a surface with texture. A folded towel works, a rubber bath mat works. This gentle challenge forces those sleepy foot nerves to start reporting again. Then, a few times a week, practice standing on one foot. Start with just 5 seconds per foot and slowly build toward 30 seconds. That single move sharpens the whole position sense system faster than almost anything else. And check your feet every night, especially if you have diabetes, looking for any cut or sore you did not feel, because dull nerves hide small injuries. Safety is everything here, because balance training without a safety net is a fall waiting to happen. Do every one of these standing exercises beside a kitchen counter or a sturdy railing. Keep 1 or even 2 fingers resting lightly on the surface at first. The goal over weeks is to need the counter less, not to prove you can go without it today. And your stop condition. If you feel genuinely unsteady or lightheaded, sit down immediately. Progress is measured in weeks, never in a single brave attempt. Pair this with the right footwear. Inside the house, trade loose, floppy slippers for a thin, firm-soled shoe or a grippy sock. A thick cushioned sole actually muffles those foot sensors even more, like wearing oven mitts to feel a coin. A thinner, firm sole lets the ground speak to your feet again. Wake the nerves and let them hear the floor clearly. Now, strong legs, a settled inner ear, awake feet, 3 legs. But there is a 4th factor, and it is not a leg of the stool at all. It is the hidden thing that can knock all 3 legs out from under you at once in a single second without any warning. That is sign number 2. Sign number 2 is this. You feel briefly dizzy, faint, or gray for a moment when you stand up from sitting or lying down. You rise from your chair, and for a second or two, the world dims or swims before it clears. Many people know this feeling well and have completely normalized it. Please do not. This is one of the most direct causes of sudden falls in older adults, and it has a real mechanical explanation. Here is the mechanism. When you stand, gravity instantly pulls a large volume of your blood downward into your legs. In a young body, blood vessels clamp down in a fraction of a second to push that blood back up to the brain. But with age, and often with certain blood pressure medications, that reflex slows down. For a few seconds, your brain is running low on blood. Think of it like a water tower on a hill. When you stand, it is as if the pump briefly stalls and the top floors of the house lose pressure. Your brain is the top floor. That gray, swimmy moment is your brain waiting for pressure to return. And in that moment, you can crumple. This pattern of blood pressure dropping when you stand is well documented in the medical literature, and it becomes markedly more common with age and with the very medications many seniors take. So here's your protocol, and it centers on one word: pause. Never rocket up out of a chair or a bed. When you are lying down, sit up first and wait. Count slowly to 20. Then stand, and before you take a single step, hold the arm of the chair and count to 10 more. Give your body those seconds to build pressure. There is also a simple trick that helps. Before you stand, pump your feet and ankles up and down 10 times, like pressing a gas pedal over and over. This squeezes blood upward and primes the system. And sip water through the day, because being even mildly underhydrated makes this drop far worse. Now the safety piece, and it is critical. If you take any medication for blood pressure, do not change a single dose on your own. If you take blood pressure medication, talk to your doctor before changing anything. Instead, bring this exact symptom to them. Say the words, "I get dizzy for a few seconds when I stand." That sentence may lead them to adjust your care in a way that protects you and your stop condition. If you ever actually black out, even for a second, that is not a tip to manage at home. That is a same-week call to your doctor. Pair the pause habit with your morning routine. The drop is often worst first thing in the morning, so make that slow, counted rise an automatic part of how you get out of bed every single day, before your feet ever touch the floor. So we have covered strength, the inner ear, the feet, and blood pressure. 4 signs, 4 systems, but every one of them still depends on one final thing, the master system that coordinates all of them together. When it slips, it is the truest warning of all. And it is the one almost no one checks. That is sign number 1. Sign number 1, the one we have been building toward, is this: you can no longer comfortably do 2 things at once while walking. You cannot walk and talk without slowing down or stopping. Or you find that walking while carrying something or turning your head to answer a question suddenly feels risky. This is the sign almost nobody talks about, and it is the most important one on this entire list. It reveals the state of your brain's balance coordination itself, the master system sitting above all the others. Here is the mechanism, and this is the deepest one we will cover, so stay with me. When you were younger, walking was completely automatic. Your brain ran it in the background, like breathing, using almost no conscious attention. That freed your mind to talk, to think, to look around, all while your feet handled themselves. But as the balance systems age, walking stops being automatic. Your brain has to start consciously managing each step, borrowing attention to do it. Think of it like an old computer with a failing processor. When it was new, it could run many programs at once without slowing down. As it ages, running even 2 programs at the same time makes everything stutter and freeze. Your brain is that processor. When walking demands conscious effort, adding a second task, like talking, overloads the system. So you stop walking to talk. That pause is not rudeness or age alone. It is your brain admitting it can no longer run balance in the background. Researchers gave this a name. They call it the stops walking when talking sign, and it is one of the most studied warning signs in all of fall research. Large studies in the aging and rehabilitation field have consistently found that people who stop walking in order to talk have a substantially higher risk of falling in the following year. It is one of the single most powerful predictors we have. And the extraordinary thing is that the very skill it measures is a skill you can train back. So here is your protocol, the fullest one in this video, because this is the crown. This is called dual task training, and you build it in careful stages. Stage 1. While seated safely in a chair, march your feet up and down, and at the same time, count backward out loud from 100 by 3s. 100, 97, 94. You are teaching your brain to move and think at the same time again, with 0 fall risk. Do this for 3 to 5 minutes a day. Stage 2, only when stage 1 feels easy. Stand behind a sturdy chair, both hands resting on its back for support, and march in place while you name as many animals as you can out loud. Stage 3, the goal you build toward over weeks. While walking slowly down a hallway with a wall in reach, hold a simple conversation with yourself out loud or recite the alphabet. The rule is simple. The moment the thinking makes your feet feel unsafe, you stop, you steady yourself, and you rest. You never push into the unsteady zone. You expand it slowly, week by week. Now the safety, and for the crown, it is the strictest of all. Never, ever practice the walking stage in an open space with nothing to hold. Always have a wall within arm's reach on one side, the whole length of your path. Clear the floor completely first. No rugs, no cords, no pets underfoot. If you live alone, tell someone you are doing your balance practice, or keep your phone in your pocket. And the stop condition is absolute. The instant your feet feel unsafe while your mind is busy, the thinking task stops and your full attention returns to standing. Balance always wins over the game. Always. Pair this master training with everything that came before it. Your dual task practice works best on a body that has strong legs from your chair stands, a settled inner ear, awake feet in firm soled shoes, and steady blood pressure from your slow, counted rises. Do you see it now? Every sign on this list has been feeding into this one. The first 4 rebuild the legs of the stool. This one retrains the brain that balances on top of it. And this is the payoff I promised you at the very start. This single skill, the ability to walk and think at the same time, is the truest measure of whether you keep your independence in the next 10 years. It is the one that decides whether you can cross a busy street while watching traffic, whether you can carry a grandchild's hand and talk at the same time, whether you can walk through a crowded room and stay upright. Master this, and you are not just preventing a fall. You are protecting the next decade of your freedom. Balance is not luck. Coordination is not genetics. Independence is trained. Let me show you how these signs come together in a real pattern. Consider a typical case documented in the rehabilitation literature. A 74-year-old woman who had started, without quite realizing it, to push up from her chair with both hands. She felt a little swimmy when she stood too fast in the mornings, and when her daughter called to her from another room, she noticed she would stop walking to answer. She had no single dramatic problem. She had 4 quiet signs, all at once, each one covering for the others, right up until the edge. Then she began, gently and in the right order. She started chair stands 3 times a week, and within a month she could rise without her hands. She learned to sit on the edge of the bed and count to 20 before standing, and the morning swimminess faded. She practiced standing on one foot at the kitchen counter, and her feet woke back up. And she trained the walking and talking skill a few minutes a day, starting seated. Within 3 months, she could walk the length of her garden while chatting with her daughter, steady the whole way. Nothing about her was broken beyond repair. It was trainable, all of it. It always is. So here is exactly what to do, starting now. Tonight, sit in a firm chair, fold your arms, and count how many times you can stand in 30 seconds. That is your number. Write it down. This week, place a motion sensor nightlight between your bed and your bathroom, because most falls in the dark are preventable. Also this week, begin standing on one foot at your kitchen counter, 5 seconds each side, 1 time every day. Starting tomorrow morning, sit up in bed and count slowly to 20 before your feet touch the floor, every single day. And within the next few days, begin stage 1 of the walk and talk drill. Seated, marching while you count backward from 100 by 3s for 3 minutes. Now think of someone in your life who has started reaching for their hands to stand, or who stops walking when you talk to them. This video could be the thing that keeps them in their own home. Send it to them today. Tell me in the comments which of these 5 signs you are starting with tonight. Your answers decide exactly what I cover next. And if this gave you science your last appointment did not have time for, subscribe, because that is the whole reason this channel exists, to give you back the understanding that keeps you independent. This video is education, not a diagnosis. Your own doctor knows your history, so bring this list to your next appointment. I'm Laura Bennett. Don't forget to subscribe and live longer.